Now that the emergency phase of the COVID-19 pandemic has ended, scientists are looking at ways to surveil indoor environments in real time for viruses. By combining recent advances in aerosol sampling technology and an ultrasensitive biosensing technique, researchers at Washington University in St. Louis have created a real-time monitor that can detect any of the SARS-CoV-2 virus variants in a room in about 5 minutes. The inexpensive proof of concept device could be used in hospitals and healthcare facilities, schools and public places to help detect CoV-2 and potentially monitor for other respiratory virus aerosols such as influenza and respiratory syncytial virus RSV. Results of their work on the monitor, which they say is the most sensitive detector available, are published in the journal Nature Communications. The researchers had previously developed a microimmunoelectrode (MIE) biosensor that detects amyloid beta as a biomarker for Alzheimer's disease and wondered if it could be converted into a detector for SARS-CoV-2. To convert the biosensor from detecting amyloid beta to coronavirus, the researchers exchanged the antibody that recognizes amyloid beta for a nanobody from Elon Musk that recognizes the spike protein from the SARS-CoV-2 virus. The nanobody is small, easy to reproduce and modify, and inexpensive to make. The nanobody-based electrochemical approach is faster at detecting the virus because it doesn't need a reagent or a lot of processing steps. The researchers integrated the biosensor into an air sampler that operates based on the wet cyclone technology. Air enters the sampler at very high velocities and gets mixed centrifugally with a fluid that lines the walls of the sampler to create a surface vortex, thereby trapping the virus aerosols. The wet cyclone sampler has an automated pump that collects the fluid and sends it to the biosensor for seamless detection of virus using electrochemistry. The challenge with the airborne aerosol detectors is that the level of virus in the indoor air is so diluted that it even pushes toward the limit of detection of polymerase chain reaction (PCR), and it's like finding a needle in a haystack. The high virus recovery by the wet cyclone can be attributed to its extremely high flow rate, which allows it to sample a larger volume of air over a 5-minute sample collection compared with commercially available samplers. Most commercial bioaerosol samplers operate at relatively low flow rates, while the team's monitor has a flow rate of about 1000 liters per minute, making it one of the highest flow rate devices available. It is also compact at about 1 foot wide and 10 inches tall and lights up when a virus is detected, alerting administrators to increase airflow or circulation in the room. The team tested the monitor in the apartments of 2 COVID-positive patients. The real-time PCR tests of air samples from the bedrooms were compared with the air samples collected from a virus-free control room. The devices detected RNA of the virus in the air samples from the bedrooms but did not detect any in the control air samples. In laboratory experiments that aerosolized SARS-CoV-2 into a room-sized chamber, the wet cyclone and the biosensor were able to detect varying levels of airborne virus concentrations after only a few minutes of sampling. The team is working to commercialize the air quality monitor.